Welcome to the Mindset Mirror Connection podcast. In today's episode, we are going to do a good old Q&A. Y'all have written in, so we are ready to respond. So if you are ready to listen up and lean in, we are about to elevate your mind.
Awesome.
Hey, Q&A, Q&A, mirror on the wall. I try to make it work. It doesn't hit.
Well,
I wanted to call it mirror because they ask a question. Who's the fairest? And they're asking us questions.
That's fair. I know.
And we'll try harder. Okay, next assignment. Listeners, what should our Q&A be called? Because Mind Pump does qua.
We do
queef.
No. Oh, yeah. I do.
It's the weekly queef.
I mean,
it's kind of hilarious. It's kind of hilarious.
You could say, queef me.
Like, queef me.
Yeah, queef me.
Oh my gosh. All right. Let us know. Does it hit? Not hit?
Yeah. Is it too
all right?
Okay, ready?
For those of you just joining us in, I am Coach Christina Hathaway. What's your name?
I'm we never introduced ourselves.
We never introduced. Well, now we have our names here because we're on the StreamYard. Yeah. For those, I'm out of town. I'll be out of town for a month and a half. So we are doing this from our virtual studio.
Yeah.
Yeah. That sounds sexy. You're on that side now.
I know.
I was on that side. It's kind of funny. Yeah. It's kind of crazy that you can take your hair down, put it up, and it still looks fantastic. If I would do that, I would look like the cousin on Addams Family. Actually, no, their hair was straight. I would look crazy. Yeah.
I don't know. Well,
anyways, that's Coach Amanda. Did you introduce yourself?
I'm Coach Amanda. Hi. I know sometimes by the end of the day, like I just can't figure out like how do I think like want my hair.
My hair is like the Statue of Liberty. It's just not moving. So we are trainers / experts in mindset. I'm a licensed associate marriage and family therapist with specialized training in fluid body obsession, as well as a personal trainer and nutrition coach. Coach Amanda, who are you? What do you do?
I am a personal trainer based out of Phoenix, Arizona, but my specialty is in the pre and postnatal population. So a lot of my clients are looking to enter motherhood, currently pregnant, or they're in the postpartum period, or post, like they're done having kids and they're all out of the house. So we focus a lot on that transition, how that those changes in your body, mindset really impact how you feel about yourself, and finding who you are again is something that we talk about often.
Yeah. I would say too, you're an honorary therapist. Coach Amanda.
I call myself, what do I say to my cousin? As your unlicensed therapist is what I tell her.
Yes.
Before I'm about to say what I have to say.
Well, you have worked with me the longest. You understand the method, and you've worked with me at one point of your life. Yes. So you get my crazy. So
in your defense, you weren't crazy when you were my therapist, though.
Good. Well, obviously.
Fine. And then we started becoming friends, and I was like, she's not fine.
Yeah. Well, and just for the board of Arizona, I was her coach.
Life coaching.
I was not her therapist.
Yes, life coach.
Because I could not do this with you if I was your therapist.
That's
like
true.
actual therapist. So I'm just saying that.
Life
listening,
coaching.
if they're listening.
Yeah.
I don't need a board thing against whatever they are. I don't even practice anymore. Yeah. Anyway, so what we do on our Q&A or queefs, our weekly queefs. Can you tell us the last podcast that we're recording for the day? Is answer your questions. Yes. So on every single one of our podcasts, we have a link to a type form where you ask your questions, and people have been responding. Or you can find them too every Sunday, which we did not do yesterday.
I know.
We will post a place for questions. We'll get it down. I mean, it's only our 27th episode. It's fine. So we're just going to jump into it today. We have a good one. So let's do it. Actually, this came up twice. So we're
starting with a banger. Okay, ready? Because you got to stay with me because it's a little bit, there's a lot of context here. Okay. So would you recommend continuing to track macros and daily weight post-surgery, even though they're unable to strength train and minimal walking for up to 10 weeks? Then, for reference, she's having a double mastectomy followed by a hysterectomy 4 weeks later. That's a lot on the body, which is
Absolutely.
putting me at a total of 8 to 10 weeks of recovery. She is 44 years old, 5'4", 153. She started group fitness, F45 style, just over years ago. So I'm not sure exactly, like a year ago or just years, and fell in love with the feeling of being strong, and switched over to a traditional gym and spent the last year doing strength trainings. Yay! Independently in the gym. Woohoo! Good for you. I have been maintaining this weight and gaining strength for close to a year at around 2,200 to 2,500 calories, which is amazing, averaging 130 grams of protein. Love it. Like, there's nothing I don't like about any of this. I have a good mindset. Love that. I decided a long time ago to stop worrying about being skinny and just focus on getting strong. And I'd hoped to take a shot at some very amateur attempts at powerlifting.
Yes.
Even love that, girl.
Did we just write a new girl crush? I think we did. This is Sarah, by the way, everyone. This is our listener, Sarah.
Okay. So she was going to attempt a powerlifting competition before the diagnosis in February, which then I decided to put off for another year. Great job. And have just been managing since. I am in a good place other than having trouble getting my head around how to navigate the next 2 months nutritionally, how to get the adrenaline fix I get from working out, and how to not lose my progress completely mentally and physically. Just thanks, and wanted to get some background for context.
Awesome. Yes. Well, thank you, Sarah. We love that you're trusting us with this question, and it is such an important question. As a woman who's had a major surgery like a hysterectomy, it can be, you can feel a little bit of defeat. And now for you, we're compounding. We have a double mastectomy, a hysterectomy. There's a lot to think about here, because not only is it, I don't want to lose my progress, but I also want to touch on some mindset stuff here in a sec. But why I love this question is because of, if you guys have been listening for a while, I use the metaphor of the boombox. Now, for those of you, did you know that our followers are age 25 and over? So for some of you, I know, we're so cool. Avi. It's probably my niece
references.
A boombox is a big radio that has multiple knobs. And the way that I explain it is that we never turn all of our knobs all the way up, and we never turn our knobs completely off. We have a knob for nutrition. We have a knob for training. We have a knob for movement, different than training. And then we have a knob for things like sleep, recovery, habits like water, steps, and a stress management knob. So why I love this question is because Sarah has figured it out. We're loving everything that you've done up to this point. And the mindset of, I just want to be stronger. And this, even though it doesn't feel like it, this situation can be one of the most mentally strong things that you will go through, because it puts you in a level of discomfort that you weren't anticipating. But because of the work you've done thus far, I think you're going to surprise yourself on what you can do mentally. But just to answer your question, in the case of surgery, injury, illness, we may have to turn down, in this case, the exercise training knob, right? Would you agree?
Yep.
I mean, because of our, we have to recover. And again, as someone who's had a hysterectomy, what we don't want to do is move too quickly and tear the vaginal cuff. There's a cuff. There is an actual suture inside the vagina that closes it off so that it's not just this endless
open gaping wound
yes, in your body.
Yeah.
And if you don't listen, you can tear that cuff. It can be very painful, obviously can cause other issues as well. I am not as familiar with a double mastectomy. However, my client just had breast surgery, and very similar. There's a lot of, obviously there's downtime from that. And so we're not able to move, specifically not able to lift heavy. And so to answer your question, I would continue to focus on nutrition would be my answer. Mm-hmm. If in your case that's tracking, great, track. If it's not, it's still turning up the nutrition knob at this point. What do you think?
So I think this is and I don't know if Sarah's going to do this, but I think this is an easy place for women to feel like, well, I'll turn up the nutrition knob by reducing the calories because I don't have the exercise component there anymore. And what I want to encourage her to do, as uncomfortable as that may seem, is to keep the nutrition at the 22 to 2,500.
Agreed.
And to keep the quality high, like high fiber, high protein. The 130 is great. Just keep the quality there, because when we're post surgery, what we don't want to do is go into a cut or like a weight loss phase or a caloric reduction, even, because your body's actually going to spend extra energy trying to repair itself.
Absolutely.
So we've already got, I think, what was it, 8 weeks or 10 weeks that she's going to be out of movement structure, essentially. That's a time where our body can recover, and we need to be able to provide calories for that. And even some studies show that going into a slight surplus could be beneficial too. Not saying she has to do that, but I would at least do our maintenance calories, which is, she's got a great kind of bare minimum there that I would go off of. So sometimes too, when clients are in this situation, even from my own experience of having surgery, this is a great time to focus on things that you've been wanting to, but just haven't for whatever reason. So for example, maybe it's getting a certification that you were interested in. Maybe it's doing something for work that helps you like get promoted or have a higher level, or just some extra like education around a topic that you're interested in. Maybe it's joining like a book club, it's not an active group, or like going to lectures or something educational for yourself. Instead of focusing on what you're not doing with the exercise portion, what are some ways you can work on? So you said your mindset's good, wonderful, but what are some other ways that I can turn that knob that we're talking about, so that way you can feel well-rounded, and then when you do return to exercise, you don't feel like you just did nothing for those time.
Right. No, I agree with you, not only on the recommendations around nutrition, but let's talk about protein, because protein is going to help in the healing process, right? Yeah. So getting adequate protein, which it sounds like for Sarah is something that she has experience doing, I would absolutely continue with that. Even if it's, like I said, if it's an injury or surgery, that is going to be absolutely so beneficial to you. And also, let's just call it as it is, fiber, and let's call it stool softener after the surgery, is going to be really helpful too, because your digestive system will slow down because of the medications that they give you, and anesthesia. The first time I had, I didn't have a hysterectomy at first. They tried to save my uterus and all of my parts. And after that surgery, I did not take stool softeners, and I can tell you, I thought I had pooped glass shards. So yeah. Second time when I had a hysterectomy, though, I had
like lesson has been learned.
Lesson learned. But then here's another thing, Sarah. So that cuff is in there, and I don't know, and I'll have to ask my OBGYNs that I work with, but I felt really good. I actually trained before, and we've actually trained clients who've had hysterectomies in our program. We've trained their bodies to be as healthy as possible going into the surgery, specifically around their glutes, their back, and their obliques, so that because their lower abdomen was going to be very weak, they still had this strength in their core to help them move after the surgery. And it's been a benefit to everyone who's done it, including myself. And why I say that is the only time I actually felt pain was when I had a bowel movement hit or brush up against that cuff. I don't know if that's exactly what happens, but that's what it felt like. So like having, obviously fiber is going to help kind of break that waist down, so it's not as like hard. Yeah. TMI, but it's going to help kind of like help things flow through. The other thing is that adrenaline rush. And what Amanda's saying is like, let's do something outside of your comfort zone that's not exercise, right? Like maybe we try, like you said, what if we wanted to really like dive into meditation? Meditation can be a great way to feel, I call it the buzz. I used to meditate and feel like I literally was like floating when I was heavy into my meditation. I get tingly all over my body. It was really cool. Now, cold therapy. Now, in your case, we're not going to be able to go into like a cold plunge, but we may even do something like a You could do a cold shower with the incisions covered, or even just put your face. That could be an adrenaline rush. Have you played Wordle? You and I need to talk about Wordle, by the way. I'm addicted. My best friend Dustin got me into it, and it's addicting, and it's an adrenaline rush because you're like playing against like the clock, and like you've got to figure out this thing, like finding something fun like that's mentally stimulating. Mm-hmm. There are so many things, and honestly, Sarah, I don't know if it's adrenaline that we're feeling. It's probably more of those endorphins of doing the workout, because if it's adrenaline, that's a cortisol thing. That is trying to find that rush of like stress hormones, which you can watch scary movies if you want to do that. You can run from a bear. Don't run. But I think what you're saying is that kind of like that feeling, that high that you get from working out, there are so many other ways to do that. Again, for me, meditation was one of them. Being creative is one of them. Again, trying something that I've never tried before. Like, just, you could learn a new language, like anything. Yep. And then, making sure those other knobs, like your NEAT is going to be really helpful here, because you do need to move in an effort to ward off blood clotting. So you're going to be walking a ton. If you are in a good shape after these surgeries, like for me, I walked as much as I physically could, not only because I needed to for prevention of blood clotting, of my blood clotting, but because I got fresh air, I got connected to nature. I literally walked in my pajamas. I actually have a video on my stories of doing that. And managing stress, learning, taking this time, this 8 to 10 weeks, like what a wonderful time to do the inward work. And I hope that you've thought about this, and I don't want to put this on you, but your body's going to go through a change that I know for the women that I've worked with, even myself, there's a sense of losing your femininity, losing your reproductive organs, on top of now also losing our breast, right? I don't know if you're doing reconstruction, but you get it. So being able to manage that, to create a new beautiful relationship with yourself, talk about a fucking high. Mm-hmm. When you can recreate that relationship with yourself that says like, I am a stronger woman now with, and we don't know what's going on with Sarah, but getting this, advocating for myself, like thinking about my future, taking the precautions so that I'm not, in my case, in pain anymore, like recreating that, like that's the high work, actually, now that I'm thinking of it.
Yep. Or even I would say joining like a support group, using that time, or even like if you feel like you've done well, becoming a mentor to maybe somebody else that's going to go through this as well, of, giving back in that sense.
There's another one, volunteer. You've got some time on your hands. And if hopefully you have a career that you're able to take this time. I mean, I was so thankful. This is when I took my hiatus and was working in sales, and I had the whole time off, like to the point where I was getting bored. Like my girlfriends would just come bring me like Postinos, and I'm like, yay. But I wanted to work, like, write a book, do something. Like, you've got all this time. There's so many beautiful things. And then at the 6 to 8 week, or for you, it's 8 to 10 week period. Like I would even have the conversation with your doctor. Like, can I do some light mobility work just so I'm moving in different ranges of motion? Mm-hmm. Talk to your doctor about what that looks like. We're not going to be able to lift heavy. We do not want to lift heavy because, again, we do not want to cause anything that can become a long-term issue down the line. But you're doing well, dear. And I am so happy that you're one of our listeners, because you're our girl crush of the week. Girl crush of the week. New segment. Yep. Our girl, Sarah. Mm-hmm. Sarah, we have you in our prayers. I am a prayer. I'm more of a, let's give this person positive viber.
Yes.
But AKA prayer. We hope that it goes well for you. Please keep us updated. And here's to a beautiful recovery from a very tough situation. But you're already showing us that you're a badass bee.
Yeah, so. Seriously.
Yeah, we love you. Take care.
So last thing, and I think Sarah's question was really good because it does allude to larger applicable things that other people can experience. So what do they do when they manage an injury? What do they do when they manage illness? Because we can think of having surgery similar to managing illness, managing an injury, right? Because I'm not saying her body is injured, but there is a change in the circumstance here.
Right.
And so one thing that as we wrap up our thoughts and prayers to Sarah is that how does the other person who maybe isn't going through such a surgery take away from this? Because it's very similar. Same things that we talked about. So as Christina says, is dials and using that as a way to manage what's happening. So nutrition wise, when we're ill or when we're having an injury, we don't want to be in a cut or a weight loss phase. If you're perpetually eating those low calories, again, now your body doesn't have the energy to heal. It's going to take it from the muscle at some point. So you're going to be losing your muscle mass, which is what you've worked hard to maintain.
Right.
Illness and injury, we need to take care of ourselves. We still need to get some sunlight, which is I always think is great. Drink your water, have your nutrition, focusing on whole quality foods, making sure you're hitting protein. So like we suggested, protein is going to help repair, build, and heal your body. Then we also want to make sure mindset wise that, and I would challenge you because a lot of the time we use the illness or the injury to think of, oh no, I'm going to lose all the gains I just made, all of the progress that I've made. And we saw that in the question of like, how do I do this so I don't lose progress? It's that just because there's an injury or an illness doesn't necessarily mean you will lose progress. It doesn't always equate. Now, if we're not using our dials appropriately, say we still continue to push through the injury or we push through the illness, we're not eating enough, our sleep is really poor, we're not taking care of our mental health, you're going to lose progress. But it's not because of the injury or illness. It's because of the reaction you're having to it. Right. And I think
and protein too, because you can actually like, if you're hitting your protein targets, I would set them like for Sarah's case, I would just set them a bit higher. You're going to maintain that muscle.
Which is fine, which is great, which is what we want. But so those are all things that you need to consider when this is happening because again, we think because I'm doing less movement, I need to therefore eat less to counterbalance that. That's not how the body works. And I would bet you if you're the typical client that we experience, you've probably done that before and then felt even worse later. Right. Absolutely. And so then we're circling back. So I would challenge you to do something different. So again, when managing an illness, like maybe you're doing, what's that? Duolingo. A lot of people do that. So maybe we dive more into that while we're recovering and just getting sunlight, going for a walk. It doesn't mean you can't do anything depending on the illness and the doctor recommendations. But what it does mean, we do need to modify. Okay. So like going to the gym when you're super sick and pushing through, that's not going to feel good afterwards. You're going to think it does because of the stress response that your body gives you.
There's no such thing as sweating it out.
Right. Yeah, correct. So, and like even an injury, you want to make sure that we're healing that injury and letting it recover appropriately rather than even returning to the gym or doing something that you used to do. And now your body's moving learning a new movement pattern. So now it's creating a compensation method that's going to cause a problem later on.
Great
Instead of, again, just let it heal. It doesn't mean you can't do anything, but what it does mean is we just modify what is available to us. Like go for a walk if that feels good. Okay, focus on mobility if we're not able to walk. Focus on meditation, feeling my body, connecting to my body. Maybe some gentle yoga that's like literally laying on the floor. Those videos are available on YouTube.
Yep.
And so I think for the gal that pushes through, coming from my own experience, if you continue to push through, the injury or the illness will catch up with you and it will force you to stop. And that is a lot harder place to be mentally than listening and trying for the week that honestly, most injuries are probably about a week.
Right.
You know, rather than just listening to it and letting your body rest and recover. If you don't do that, you're going to be forced to. And that's not a very fun time.
Absolutely. And then you're in a longer period of recovery where now we're actually losing muscle and doing all the things. So good. So we wanted to double up Sarah's question with another question that was about that, like how to handle illness and injury. So beautifully said, my dear. All right, moving on. What do we got?
So, okay. So Nicole submitted a question that I think goes in with another question that was submitted for us. So Nicole's question is, what body fat percentage do you think is a healthy range for women? But we also had another question that was, what are the best health factors as a woman? So
and body fat was one of those.
And body fat
One
was
of
one
the
of those.
questions.
So we're going to combine those two as well.
Perfect.
So curious to hear your thoughts on what are the health factors and what's a good range for these.
Okay, well, I'll start with health factors.
Okay.
I think for women specifically, some of the most specific things, especially as we're getting older, one of the most one of the your body will tell you how healthy you are is your period. Your menstrual cycle is going to tell you how healthy you are. If we're not having one, that's an issue.
Yes.
If when we're having it, it's causing us to be in the fetal position, that is an issue. If we are, spotting 1 week and then having a full-blown period 2 weeks later and it's intermittent and off, then we need to look into that, right? So one of the major things for women is like how is my cycle of my period? How consistent is it? How consistent is the flow? What do I feel like? Am I having it all the time or am I having it, again, especially if someone's going in perimenopause, you're going to have a lot of differences there. If someone has issues with like PCOS, we're going to see challenges. Specifically, my clients with PCOS have really heavy periods. So for me, for women, your menstrual cycle is going to be one of the major things to pay attention to. What are your thoughts?
I would definitely agree with that. I would also, so BMI usually comes up here and I'm like, it's great until it's not great. Right. So you and I would probably be considered obese at this point. But if we want to use BMI as another measure on top of what we're already using, I'm okay with that, as long as similar to the scale, right? So we could use the scale as another measure of health, but it doesn't tell the whole picture.
Right.
So, and those are my two least favorite probably out of all of this. But those are the two most common, right? And they're the two most common that you see in doctor's notes as well. And a lot of doctors are prescribing based off of these things, not realizing that you can have a high BMI, but be very lean because of the muscle mass, right? So my weight's going to be more because I have more muscle mass. So those are two things that I did want to touch on specifically because those are what most people are going to look for. But I think a better one is going to be your circumference measurements, right? So what is it? The waist to hip ratio for women?
Right.
So,
and just
go ahead.
to point out that is like, if we're holding a lot of visceral fat over our major organs, like in our belly, because that's where our organs are, then we need to pay attention to that because that can cause cardiovascular and like several chronic issues. So the waist circumference, I would use it from that perspective, not necessarily like how small am I snatched like Kim Kardashian at the Met Gala.
Right.
So sorry, I cut you off. It's okay.
So I would definitely like waist, and I think even waist to hip ratio, great, but also just those circumference over as we're changing our habits, our norms that we use. That's another measure of, okay, is this trending in the right direction? That again, the scale might stay the same. Your BMI might technically stay the same, but your waist is getting leaner or losing inches. That's the perfect place to be as well. What about you? What's another thing that you measure women's health on?
I'm going to measure how we feel. I think fatigue is such a like gateway drug to a lot of things that women experience, specifically, Hashimoto's, PCOS, any sort of like autoimmune issues, obviously the menopause transition. And how do we feel? Are we feeling energetic? Do we need 10,000 cups of coffee? Really listening to your body and paying attention to its cues, right? Am I feeling, do I have headaches all the time? Do I crash at the end of the day? Not the end of the day, but midday.
Yeah.
So paying attention to your energy levels. And now we're just touching on the surface here, but if we want to go into like deeper in regards to what to talk to your doctor about, I think that it's important. We are going to have a guest that I'm interviewing next week who is a naturopath. Yes. And she's going to talk about women's health, specifically for women 35 and over, and like what supplements and what testing to look for. But I'm going to touch base on the ones that I personally know, just having my experience in working with menopause transition. I think your thyroid and not just your TSH, because I've had that happen to me where a fucking doctor told me, oh, well, your thyroid stimulating hormone will be tested and your your metabolic, your normal metabolic panel. And he's like, oh, it's great. It's fine. My mom had thyroid cancer, y'all.
Right.
And I told him that, like, no. And I go to TIA, which is a female only program, medical program here in Scottsdale. I don't think we've talked about it before. And their minimum testing is your at least your vitamin D, your vitamin B, and then your blood panels. And then you can just ask. I asked, they're like, yeah, we'll do your entire thyroid panel. I think a thyroid panel is incredibly important. Obviously, breast health, if we're over, I mean, I don't know what age you're supposed to start doing your breast exams, but we definitely, let's look that up. We definitely want to be making sure that we are testing for breast cancer. I had a client recently have a mass removed and we found out it was cancer. So now she is going into the process of treating that cancer. But luckily for her, it was early on and she was able to find that. I don't remember if it was in an actual exam or if it was in a mammogram. Like, I don't know if it was like a physical exam that she did on herself or it was a mammogram. But if you are over age of 40, like me, we need to be having your mammograms.
Yeah. So
yearly.
It says age 40 and above, annual breast exams along with mammograms are recommended. For 20 to 39, generally recommended to have a clinical breast exam every 1 to 3 years. And I do want to touch on when you're talking about blood work and thyroid panels and how someone feels, is that even say you get the full panel, like of thyroid, of the blood work, everything, and it feels, and it says it's all within normal limits, but you still don't feel good, then we need to advocate for ourselves. And hopefully you have a provider that is willing to work outside the scope of parameters, if that makes sense. Because just because everything shows normal, it may not be normal for you. Right. And so if you're not feeling well but it's normal, there still is a provider out there, I promise you, who will say, that's completely fine. Let's figure out the solution to how you're feeling and use, again, like how we've talked about the blood work as just another data point too. It's not the only data point that we make these decisions off of.
Yeah, absolutely. I've seen it where, and the other thing too is there's this like optimal level of your hormones as well. And a lot of people will just compare the average, which if you're a healthier individual, but you still feel like crap, like you don't necessarily want to be compared to like everyone else.
Right,
so you can also look at like optimal level versus like your standard level of what is, considered like good or not. Yes. In regards to your physique, right? To answer the question around body fat percentage. Now, for us, we are using, for a client, because we're not doctors, we can't do testing. Can we help support whatever comes out of the testing with our team that we're working with? Yes. However, we are looking more at body composition over the scale 1,000. Because here's the thing, guys, I ask my clients this all the time, like, if you looked the way you think that number feels, would you be all right?
No.
If they looked what they think in their head 135 looks like, if they looked like that, no matter what the scale says, would you be okay with it? Yes.
I'm trying to
so I'm 152 and people will think that 120 looks like this.
Right.
But I'm 152. Do I care if I'm 152? No, I don't give a shit because I look the way I look, right? So sorry if that was confusing. So body composition, we will, you can get a DEXA scan. That's helpful, but I've had clients have a bad DEXA scan in between two good DEXA scans, right? You can do progress photos. I think those are helpful if, and if we're having trouble with them, then obviously, as you say all the time, then we need to pay attention to that. We need to process that. And in regards to the healthiest body fat percentage, what women don't understand is that our essential body fat, we are a higher body fat percentage because guess what? We make people. So essential body fat is anywhere between 10 and 13% body fat. Right. And what essential means is like, we're just surviving.
Yeah.
This Zoom is like, I just have like a starburst come out of my mouth. If you are an athlete, these are people who are competing, who are athletic, 14 to 20%. Now, these vary in each certification.
Right.
If you're fit, right, or what they call fitness, we're between 21 and 24%, and average is between 25 and 30%.
Right.
So for the average person who's just looking for general health, I would say anything between 25 and 30% is what we want to get to, right? For me, I've been 15% at one point in my life, and I've talked about it and the cost of getting lean and how I got there. So if we're talking about health, that wasn't healthy.
Right.
That was not healthy, and it didn't look healthy. I looked gross. So I like to, because I'm a leaner, I've been lean my whole life. I like to stay around the 20% range. I think that's good for me. I've gotten up to 24, but that was an in-body scan. So I don't know how accurate that was, but for the women listening, for general health, you're feeling good, you look great. I would say anywhere between, 21 and 30%.
Yep.
With 21 being looking pretty lean.
I know. And it to me, a lot of women don't understand that it's higher than they think. They think like, oh, the average woman should be like maybe 15 to 20. And it's like, nope, it should be higher.
Way higher.
Yeah. And so when they see the disappointment of those results or readings or like some calculator they found online, it's kind of like, well, in all reality, so like when we're thinking of like, okay, the leanest, the bare minimum, who's really going to be there? You're probably your bodybuilders who are like on day of competing.
Right.
And then we go ahead.
No, go ahead.
And then we think of athletes. Okay. Yes, we're athletes because we work out and strength training, but are we getting paid as a job to perform this? Do we have people who are setting up our meals, setting up our nutrition, setting up our programming, setting up our days? Is our husband literally meal prepping for us and taking care of the kids because my job is to be this athlete?
Right.
No.
Or have a chef doing that.
Yeah. So then like a 14 to 20% really gets kind of unreasonable. So 21 to 24, there's our 20% all the way up until 30% being your normal.
Right. And I want to just bring this up as male essential body fat is 2 to 5%. So you wonder why like your husband can lose all of this weight and you can't, because your body is literally designed to keep body fat.
Right.
Why? Because go back to the first thing I said. If you are in reproductive years, your cycle is one of the most important health factors that we have as women. And if I'm at a low body fat percentage, that's going to go away because my body is like, this bee cannot bring a child into this world. Her body is not safe to do so. Yes. Men don't get to do that. And that's why like my husband, ate an apple and lost 10 pounds. Well, it's because he's not a fucking superhero. He can't make babies.
Well, and I do want to touch on that too, because I see a lot of women who want to lose weight before they're trying to do that. And then when I start inquiring, they have already lost their period or their period is irregular. And to me, that's a red flag that losing weight is not your solution to what you're trying to do here. In fact, it's going to be even more detrimental. So let's say like if your period is gone or your menstrual cycle is gone or irregular, and there's not sorry, I keep hitting my desk. There's not a diagnosis that would explain that, and you're not working with someone, like it just went away and you're active and you eat, that's a red flag.
Yeah.
That this body is not ready to harbor a baby. And it doesn't mean that it can't. It just means it will be incredibly challenging. One, because you're not ovulating regularly and we have to have sex during ovulation to create a baby. But on top of that, now you're going to be in a mind fuck because now we've got to gain fat to create that. When your whole perception has been, I need to lose weight, I need to lose weight, I need to lose body fat, I need to get leaner. Then I can have the baby because then I've got the body. And as someone who has been in this stages, you do not get the body, get the baby.
Right. No,
it doesn't work that way. Once the body's there, and that is just your body. The baby comes when the body feels safe, when the body has enough kind of help, we'll say, like hormones, extra food, safe space, safe environment to have baby.
Right.
And so that's one thing where you're touching on the hormonal cycle, and then fat where it comes into this. And if those things aren't aligning, I would say, again, going back to what is healthy and how do we measure that for a female, those are some things.
Yeah. A few other tests that I want to bring up to you is like your cardiovascular health. Cardiovascular disease is one of the killers of women. Bone density test. And I'm not going to say we don't need to test that. What I would just do is really focus on strength training and protein intake. That has shown that it can reduce all-cause mortality, right? Because when women fall, we break. If we break, we die. That's not really exactly how it happens, but close enough.
Yeah.
And obviously just getting a physical, and like Amanda said, like listening to yourself, trusting yourself. And if you don't like the response that you're getting, then you can get a second opinion. And that's exactly what my client who had the cancer, who was having the cancer scare, like she's also getting a second opinion on what's going on with her so that she can, understand her options. So I would, getting full blood panels, thyroid testing. Oh, and obviously, at a certain point, we also want to see what's going on with our reproductive hormones, understanding where they're at. And that does not just have to be in the menopausal transition or when we get older, because again, something like PCOS is going to be an elevated testosterone, and PCOS can cause infertility issues and a slew of other issues, including weight gain. So again, listen to your body, especially guys. This is why we're such big advocates for eating more and moving less, getting our body to this kind of homeostatic place, because it'll tell us what it needs. But when we're forcing it to be in this stress state, it's just trying to survive. And when we can get it, like maintenance is so beautiful, because if there is something going on and we're eating enough and we're moving less and we're trying to manage our stress and we're still feeling something, all right, then we should probably do something about it, right? But I'm going to feel like shit when I'm eating in a deficit.
Yes.
So good. Okay. Let's do one more. One more question. Because we technically just did 4. I have one that someone asked.
Okay.
Oh, when is your due date?
I was like, oh, wait, there is another. It is in November. Let me look.
November. Oh, no. Are you having a Scorpio baby?
I don't know. I know nothing about horoscopes. I hardly know when my babies do. Let me find
it. Everyone, I will make sure to give you the updates. We'll ask Michael.
November 16th is technically when it's due.
I think that's the cusp. Scorpio cusp.
Oh, at least it's on a Saturday, technically.
November 18th through the 24th is the cusp.
So he's not a Scorpio?
No, I think then he is it a boy?
Oh, I don't know. It's a Scorpio. Sorry. I don't know the sex yet. That's another issue.
Libra.
It's a Libra. So what is Libra?
Libra is September 23rd to October 22nd.
What person?
Oh, no, I'm lying. Libras Scorpio, have? October 23rd to November 21st. That doesn't seem right.
Here,
that's not right.
Horoscopes.
Because my mom's. All right, let's look at this one. Is that right, guys? Everyone's like, it's right. Yeah, that's right. I know. Yeah, so your baby is going to be a Scorpio. All right, well, good. Well, this, let us know if you like what name our Q&A should be.
Yes.
The Weekly Queef. That's so derogatory. I don't know. It's hilarious. Look at when I smile. Now I look like I have like.
Oh my God. You need to I
Oh, it's the diamond.
Yeah, I told you
it. Thing. Oh.
That thing. Yeah.
Oh, so I just need to move over. So
yeah.
Okay. There.
Yeah.
Which I don't know why.
Oh, because I'm just sitting lower.
Does this mean I'll have like a plant in my mouth? Hold on.
Eat it. No, it only doesn't.
If you guys are not watching this, it's classic.
Yes.
All right. Well, that's it. That's our Q&A. I thought we had one more, but that's all right because I'm going to go eat dinner. If you guys want to ask us questions, we love questions. And they can literally be funny. They can be, as Sarah did here. Thank you, Sarah. Give us as much detail as possible. You can stay anonymous or you can share your name. We ask you that in the actual form. Please reach out to us. And also you can find it on our Instagram stories where you can just ask a question there. My Instagram is Mindset of Matter Coaching. Amanda's is fitbyamanda.az. You can find this recording of us on YouTube at The Mindset of Matter. And if you are interested in coaching with us or understanding what we do, you can also find a link to our Clarity Call. Anything else?
No,
nada. All right. Well, if you take one thing away from this podcast, it is remembering one thing.
What you say in the mind,
you see in the mirror. Goodbye.